Let's talk about pain. It's that universal, unavoidable signal that something in your body is wrong. But what if you could intercept that signal? Today, we're diving into a really cool piece of tech that offers a way to manage pain without drugs, basically by hacking your body's own internal wiring. Let's get into it. Just think about that for a second. Instead of having to take a pill and wait for it to work, what if you could literally just reach for a dial and turn down the intensity of your pain? It honestly sounds like something out of a sci-fi movie, but it's way closer to reality than you probably think. For so many of us, pain, whether it's chronic or just temporary, is this constant, unwelcome thing we have to deal with, and the search for relief can feel pretty endless. The solution we're looking at today uses a tool that, I'll admit, sounds a little bit shocking at first, and that's a gentle, controlled electrical current. Now, you might be thinking this whole electricity for pain thing sounds super modern, right? Well, you'd be surprised. It actually has this fascinating and really long history that's kind of crucial to understanding the devices we have today. So this goes way, way back. We're talking ancient times, where people would literally use electric fish to try and numb pain. But the science really took a leap forward in 1965 with this revolutionary idea called the gate control theory of pain. That theory was the game changer that led directly to the small portable TENS units we know and see today, which popped up in the 1970s. Okay, so what in the world is TENS? Well, the name kind of gives it all away. Transcutaneous. That just means through the skin. Electrical nerve stimulation. So, you're using a mild electrical current right on your skin to wake up your sensory nerves. And the goal? Pain relief. It's that simple. All right, this is where it gets really cool. How does a little bit of buzzing on your skin actually stop you from feeling pain? We're about to get into the brilliant science of how TENS pulls off this amazing hack on your nervous system. So think of your body as having these different information highways sending signals to your brain. You've got the pain highways. Those are your A delta and C fibers that carry those sharp or dull aching feelings. But you also have these really big, really fast touch highways, the A beta fibers. And those are the secret weapon TENS uses. And this brings us right back to that game-changing theory from 1965. Malzak and Wall had this incredible idea. What if there's a kind of neurological gate in our spinal cord? And if you could send a ton of traffic down those big touch fiber highways, you could essentially close the gate and just block the pain signals from ever getting to the brain. This visual makes it so easy to get. So normally, the pain gate is open. The pain signals have a clear shot straight to your brain, and you feel the ouch. But when you flip on a TENS unit, that buzzing sensation activates all your touch fibers. It creates this huge sensory traffic jam at the gate, and the smaller pain signals just can't get through. They're blocked. But wait, there's more. TENS isn't a one-trick pony. Closing the gate is just one way it works. There's a second path. With different settings, TENS can actually get your body to release its own natural painkillers. You know, endorphins. So the gate control is super fast, but it stops when the machine stops. The endorphin release takes longer to kick in, but that relief can last for hours after. Pretty amazing, right? Okay, so the science is solid, but how does this actually work in the real world? Let's take a look at how you would actually tune one of these devices to get the kind of pain relief you're looking for. So a typical TENS unit is going to have three main dials. You've got intensity, which is just what it sounds like, how strong the buzz feels. Then you have frequency, which is how many little pulses you're getting every second. And finally, pulse width, which is how long each of those little pulses last. It's the unique combo of these three that changes how you get relief. So let's say you want that fast-acting relief we talked about. You'd use what's called conventional TENS. For this, you dial up a high frequency, which creates that constant, comfortable tingling. This setting is specifically designed to get those big touch fibers firing and slam that pain gate shut. It works fast, but remember, the relief usually fades when you turn it off. Okay, but what if you're playing the long game and want relief that sticks around? That's where you'd switch to acupuncture-like TENS. Here, you use a really low frequency and you turn up the intensity until you can actually see little muscles twitching. It's that stronger, slower pulse that signals your brain to release its own powerful endorphins. It takes a bit longer to feel it, but the relief can last for hours. So, the million-dollar question, who can actually benefit from this? And, just as important, are there times you absolutely should not use it? Let's quickly run through a user's guide. The list of conditions that TENS is used for is actually pretty huge. It's super common for things we've all heard of, like low back pain and arthritis. But it's also used for acute pain after surgery or from a sports injury. And it's even been shown to help with really complex stuff, like nerve pain and phantom limb pain. Okay, listen up, because this part is incredibly important. While TENS is really safe for most people, there are some absolute no-goes. If you have a pacemaker, the signals could interfere with it. It should never be used on the belly or low back of a pregnant woman, placed directly over a tumor, or on the front of your neck. And for those with epilepsy, you want to avoid using it on the head or neck. As with anything, always talk to a doctor first. So when you weigh it all out, what's the bottom line? Well, the pros are pretty big. It's non-invasive, it's safe, it's portable, and it gives you control, which can mean taking less medication. But on the flip side, you have to remember it's not a cure. It's managing a symptom. The relief can be temporary, and honestly, it just doesn't work for everybody. And all of this leaves us with a really fascinating question to chew on. As our understanding of our own nervous system gets deeper and deeper, technologies like TENS really represent a shift. It makes you wonder, are we slowly moving towards a future where managing pain is less about what we swallow and more about the signals we can control? Something to think about.